Before you agree to your next annual scan, I want you to stop for just a moment. Because one of the biggest mistakes I see isn't that people refuse medical tests. It's that good, responsible people say yes to every scan they're offered without ever asking whether they truly need it. If you're over 60, you've probably been told that finding problems early is always the safest choice. Most of us believe that. In many situations, it's absolutely true. But here's what almost nobody explains. Some routine scans can find tiny abnormalities that would never have caused symptoms, never threatened your health, and never affected your life. Yet once they're discovered, they can trigger more scans, biopsies, unnecessary procedures, months of anxiety, and sometimes treatments that provide little or no real benefit. I'm Dr. Juliet, and after years of caring for older adults, I've watched too many people believe that more testing automatically means better healthcare. The truth is, it isn't always that simple, and that's exactly why I believe this conversation matters. In today's video, I'll explain 4 annual scans that are often misunderstood, who may truly benefit from them, who may not, and the one question every older adult should ask before agreeing to any imaging test. Now, let's begin. One of the hardest conversations isn't convincing patients to get a test. It's explaining why they may not need one. That can feel confusing because, for decades, we've been taught that more testing automatically means better protection. It's a belief that comes from good intentions. We all want to catch serious diseases as early as possible. I understand that completely. But medicine has changed. Today, we know that the best healthcare isn't about ordering every available test. It's about choosing the right test, for the right person, at the right time. That's why I'm making this video. Not to tell you to avoid scans, not to encourage you to ignore your doctor's advice, but to help you have better conversations, ask better questions, and understand when a scan is likely to help you, and when it may expose you to risks that many people never hear about until after the fact. Knowledge doesn't replace your doctor. It helps you become a better partner in your own healthcare. Before we talk about the scans themselves, there's something every older adult should understand. Many people assume a medical scan works like a flashlight. It shines a light on a problem, the doctor fixes it, and everyone goes home with peace of mind. Sometimes that's exactly what happens. But sometimes, a scan works more like turning on every light inside a crowded room. Suddenly, you notice tiny things you never would have seen before. Some of those findings matter. Many do not. Doctors even have a name for these unexpected discoveries. They're often called incidental findings. These are small spots, cysts, nodules, or other changes that are found while looking for something else. Most never become dangerous. In fact, many people live their entire lives without knowing they're there. The challenge is this. Once something is discovered, it's very difficult to simply ignore it. That often leads to another scan, then another appointment, sometimes a biopsy, sometimes surgery, and all of this can happen even when the original finding would never have caused a single symptom. There's another issue many people don't realize. Some imaging tests use radiation. While the amount from a single scan is usually low, repeated scans over many years can gradually increase your lifetime exposure. That's one reason doctors carefully weigh whether a scan is truly necessary before ordering it. This doesn't mean scans are bad. Far from it. The right scan, ordered for the right reason, can detect life-threatening diseases early and save lives. The problem isn't the technology. The problem is using it when the expected benefit is very small, or when the risks outweigh what you're likely to gain. And there's one hidden reason: unnecessary scans sometimes lead to treatments people never actually needed. It has nothing to do with radiation, and it's one of the least understood concepts in modern medicine. We'll come back to that shortly, because once you understand it, the rest of today's video will make perfect sense. So with that foundation in place, let's look at the first annual scan that deserves a closer conversation before you automatically agree to it. This first scan is one that has become increasingly popular, especially through private health screening packages. A full-body CT scan. The idea sounds reassuring. You may have seen advertisements promising to check everything, detect hidden diseases early, and give you complete peace of mind. For many people, especially after turning 60, that promise is incredibly appealing. After all, if a scan can look at nearly your entire body, why wouldn't you want one? Here's the problem. For people who have no symptoms and no specific medical reason for the test, major medical organizations generally do not recommend routine full-body CT scans as part of an annual health check. Why? Because looking at more of the body doesn't always mean finding more disease that actually needs treatment. Instead, it often means finding more things that simply come with aging. Small lung nodules, tiny kidney cysts, benign liver spots, minor changes in the spine. Many of these findings are completely harmless. Some have probably been there for years. Others may never change for the rest of your life. But once they're discovered, they can be difficult to ignore. Your doctor may recommend another scan in 6 months, perhaps another one a year later. You might be referred to a specialist. Some people even undergo biopsies or procedures, only to learn that nothing dangerous was ever there in the first place. And there's another consideration. Unlike ultrasound or MRI, a CT scan uses ionizing radiation. A single medically necessary CT scan usually provides far more benefit than risk. But when CT scans are repeated without a clear reason, the balance begins to change. This is why healthcare providers carefully consider whether the information gained from the scan is likely to improve your care before recommending it. Now, I want to be very clear. If your doctor orders a CT scan because you have symptoms, you've had an injury, you're being evaluated for cancer, or you have a medical condition that requires imaging, that's an entirely different situation. Those scans can be life-saving. Today's discussion is about routine annual scanning in otherwise healthy people, not medically necessary testing. And here's something that surprises many people. The greatest risk of an unnecessary scan isn't always the radiation. It's what happens after the scan. We'll talk more about that hidden chain reaction in just a few minutes, because understanding it may completely change the way you think about preventive testing. But first, let's look at another scan that millions of older adults assume is completely harmless. Yet for some people, it can also lead to unnecessary worry and follow-up testing. The next scan often surprises people because it doesn't involve radiation at all. It's a carotid artery ultrasound. This painless test uses sound waves to look at the large arteries on either side of your neck. These arteries carry blood to your brain, so it's easy to understand why many people assume everyone over 60 should have this scan every year. After all, if it can help prevent a stroke, why wouldn't you want it? That's a reasonable question. The answer is that, for most adults who have no symptoms and are not at high risk, routine screening with a carotid ultrasound has not been shown to reduce the risk of stroke. That's because significant narrowing of these arteries is relatively uncommon in people without symptoms, and the test can sometimes identify mild narrowing that would never have caused a problem. When that happens, the focus can shift from keeping you healthy to chasing a finding that may never have affected your life. You may be asked to repeat the ultrasound every year. You might undergo additional imaging. In some cases, people are referred for procedures that carry their own risks, including bleeding, nerve injury, or even stroke. Procedures that may not have been necessary if the original finding was unlikely to cause harm. Now, this doesn't mean carotid ultrasounds aren't valuable. They absolutely are for the right person. If you've had a stroke, a transient ischemic attack, sometimes called a mini-stroke, or your doctor hears an abnormal sound over your carotid artery during an examination, this test can provide important information that helps guide treatment. The key is that the scan should answer a specific medical question, not simply be done because it's part of a yearly package. This brings us back to the hidden chain reaction I mentioned earlier. Many people think the danger begins with the scan itself. In reality, the scan is often just the first domino. One unexpected finding leads to another appointment. That appointment leads to another test. The next test raises another question. Before long, you're making decisions about something that may never have threatened your health in the first place. Doctors have a name for this process, and understanding it may completely change the way you think about preventive medicine. I'll explain it in just a moment because it's one of the most misunderstood concepts in healthcare. But first, if you're finding this information helpful, I'd love for you to subscribe to the channel. My goal isn't to discourage you from getting medical care. It's to help you understand it, so you can have informed conversations with your healthcare team and make decisions with confidence. Now, let's talk about the hidden concept that ties everything together, and why it's often more important than the scan itself. This is the part of the conversation that most people never hear. And once you understand it, you'll see why even a perfectly accurate scan isn't always a perfectly helpful scan. The concept is called overdiagnosis. Now, don't confuse that with a misdiagnosis. They're not the same thing. A misdiagnosis means the diagnosis was wrong. Overdiagnosis means the diagnosis was technically correct. The scan really did find something, but that finding was so slow-growing, so harmless, or so unlikely to ever cause symptoms that it never would have affected your life if it had remained undiscovered. That may sound difficult to believe, but it's a well-recognized challenge in modern medicine. As imaging technology has become more advanced, today's scanners can detect incredibly tiny abnormalities that doctors couldn't even see a few decades ago. On one hand, that's wonderful. It has helped detect serious diseases earlier than ever before. But on the other hand, it has also increased the chances of finding things that simply don't need treatment. Here's an example. Imagine a tiny thyroid nodule. A scan performed for an entirely different reason happens to find it. You feel perfectly healthy. You have no symptoms. If that scan had never been done, you might have lived the rest of your life without ever knowing the nodule existed, and without it ever causing a single problem. But once it's discovered, it becomes very difficult to ignore. Another scan is recommended, perhaps a needle biopsy. More follow-up appointments, weeks of waiting, months of worry, sometimes even surgery. Not because you became sick, but because something harmless was found. That's why many experts today encourage a simple but powerful question before any imaging test. How will the results of this scan change my care? If the answer is that the findings would lead to a treatment that could improve your health or save your life, then the scan may be exactly the right decision. But if the answer is less clear, it's worth having a thoughtful conversation with your healthcare provider about whether the test is truly necessary for your individual situation. Remember, good medicine isn't about doing more. It's about doing what's most likely to help you. With that understanding in mind, let's move on to another annual scan that many people request with the best of intentions, but that isn't always recommended for everyone. The annual chest X-rays. Even today, many adults over 60 believe getting a chest X-ray every year is a smart way to catch lung disease or even lung cancer early. On the surface, that seems perfectly reasonable. Your lungs are one of the most important organs in your body, and lung cancer can be difficult to detect in its early stages. So why not take a quick picture every year, just to be safe? The answer is simple, because for most healthy adults who have no symptoms, an annual chest X-ray has not been shown to reduce the risk of dying from lung cancer or many other serious diseases. That's why routine yearly chest X-rays are generally not recommended for people who feel well and have no specific medical reason for the test. Instead, they're usually reserved for situations where there's a clear concern. For example, if someone develops a persistent cough that won't go away, coughs up blood, experiences unexplained weight loss, has chest pain, or their doctor suspects pneumonia or another lung condition, a chest X-ray can be an important diagnostic tool. Notice the difference. The scan is being used to answer a medical question, not simply because another year has passed. Here's something else many people don't realize. A normal chest X-ray doesn't guarantee that everything is fine. Some early lung cancers simply aren't visible on a standard chest X-ray. Ironically, a person may walk away feeling completely reassured when, in reality, the test wasn't the best screening tool for their situation. For people who are at high risk for lung cancer, such as certain current or former heavy smokers who meet specific eligibility criteria, doctors often recommend a low-dose CT scan instead of a routine chest X-ray because research has shown it can detect lung cancer earlier and reduce deaths in those higher risk groups. So this isn't about avoiding screening. It's about choosing the screening method that's supported by evidence for your level of risk. Now, the final scan we're about to discuss may surprise you more than any of the others. In fact, many people specifically request it every year because they believe it's one of the best ways to protect their heart. But depending on your situation, it may provide far less useful information than you expect, and in some cases, it can lead to a chain of testing that never needed to begin. Scan 4, Yearly Heart CT Calcium Scans. This one has received a lot of attention in recent years. It's called a coronary artery calcium scan, often shortened to a calcium score. This specialized CT scan looks for calcium deposits inside the arteries that supply blood to your heart. The more calcium that's present, the more plaque has likely built up over time. It's an impressive test, and when it's used for the right person, it can be incredibly helpful. But here's where many people become confused. Some adults believe that once they turn 60, they should have this scan every single year. That's not how the test was designed to be used. A coronary artery calcium scan is not meant to be an annual checkup for everyone. Instead, it's most useful when a doctor is trying to better understand the heart disease risk of someone whose treatment plan isn't already clear. For example, imagine two people with similar cholesterol levels. One may clearly benefit from medication based on their overall risk. The other may clearly not. But there's a middle group where the decision isn't obvious. That's where a calcium score can sometimes help guide the conversation. Once that decision has been made, repeating the scan every year usually doesn't provide meaningful new information for most people. Here's why. Calcium in the arteries often increases naturally with age. Seeing a higher score on a later scan doesn't automatically mean you've suddenly become unhealthy or that your treatment needs to change. In many cases, your doctor is already focusing on the things that truly lower cardiovascular risk: keeping blood pressure under control, managing cholesterol when appropriate, staying physically active, avoiding tobacco, eating a balanced diet, and controlling diabetes if it's present. Those actions matter far more than watching a number change from year to year. And there's something else to remember. Every scan should answer a question. If the answer to that question isn't likely to change your treatment, then it's worth asking whether repeating the test is necessary. That's the conversation evidence-based medicine encourages. Not fear, not blind reassurance, thoughtful decision-making. So what should you take away from everything we've discussed today? It's not that scans are dangerous. They're not. Modern medical imaging has saved countless lives. CT scans, ultrasounds, MRIs, mammograms, and many other imaging tests have transformed medicine for the better. The message is much simpler than that. A scan is most valuable when there's a clear reason to perform it. The goal isn't to find everything. The goal is to find the right thing, at the right time, in the right person. That's what good preventive medicine has always been about. So before your next annual physical, remember the one question we promised at the beginning of this video. Doctor, how will the results of this scan change my care? It's a respectful question. It's an informed question. And the answer can help you understand whether that imaging test is likely to benefit you or whether careful observation may be the wiser choice. In many cases, that one conversation is far more powerful than automatically saying yes to another scan. Before we finish, let me leave you with 3 simple steps you can use before agreeing to any imaging test. First, ask why the scan is being recommended. Is it because you have new symptoms? Is it to monitor a condition you already have? Or is it simply being offered as part of a routine annual checkup? Understanding the reason behind the test is the first step toward making an informed decision. Second, ask how the results will change your care. This is one of the most important questions you can ask any healthcare professional. If the scan is likely to help your doctor diagnose a problem, guide treatment, or prevent a serious illness, it may be exactly the right test for you. But if the answer is unclear, don't be afraid to ask whether there are other options or whether waiting and monitoring your health is reasonable. Third, remember that good healthcare isn't measured by how many tests you have. It's measured by whether those tests help you live a longer, healthier, and better quality of life. The goal isn't to avoid medical care. The goal is to receive the care that's most appropriate for you. If today's discussion helped you see medical imaging in a new way, I'd love to hear from you. In the comments, tell me this. Have you ever had a scan that led to unexpected follow-up tests or procedures? Or is there a medical scan you've been wondering about? Your experience could help someone else who's facing the same questions. If you found this video helpful, please give it a thumbs up and share it with a friend, a spouse, or a family member over 50. It could start an important conversation before their next annual checkup. And if you haven't already, be sure to subscribe and turn on notifications. Every week, I share practical, evidence-based health information to help adults over 50 make confident decisions and enjoy healthier, more active lives. And don't miss my next video. Thank you so much for watching. Until next time, take good care of yourself, stay informed, and I'll see you in the next video.